Welcome to the deep dive.
Yeah.
Today, we're going to be taking a deep dive into the anatomy of the abdominal wall.
Yeah.
We've got some excerpts from medical texts, the kind that surgeons use to get a handle on this very intricate area.
Yeah, that's right.
Now, before you think, wait, I'm not planning on having surgery anytime soon, trust me, this is relevant to everyone.
Absolutely.
It impacts everything from how our bodies move to, yes, even how they heal if surgery is ever on the table.
Yeah, we're talking about a really foundational understanding of your own body.
Right.
And it's going to reveal some pretty surprising details along the way.
Okay.
Did you know there's a hidden triangle in your groin area?
Oh, wow.
And that some of your abdominal muscles might actually be missing?
Okay. A missing muscle. I'm intrigued.
Yeah.
But let's start with the basics.
Right.
We're talking about what's right under our skin, right?
Yes.
What could be so complex about that?
Well, even the skin itself has some hidden layers to it.
Okay.
If you think about those lines that run across your abdomen, those are called Langer's lines, and they're kind of like the grain of wood.
Oh, interesting.
Surgeons actually know that if they cut with those lines, make those horizontal incisions,
Yeah.
that leads to less tension and better scars.
Ah, so that's why C-section scars are often so low and so neat.
Exactly.
It's all about working with the body's natural structure that makes sense.
Exactly.
So what's underneath that top layer?
Right beneath the skin, we've got what we call subcutaneous tissue, which is a fancy way of saying fat, but it's not just one big blob of fat.
Okay.
There are actually two distinct layers here
Oh,
that are separated by fibrous tissue.
interesting.
And the first layer, Camper's fascia.
Okay.
This varies wildly in thickness from person to person.
I see.
Let's just say that some of us have more Camper's fascia to thank for our curves.
Okay, so that explains a few things.
Yeah.
And what about that deeper layer?
The deeper layer is Scarpa's fascia, and this is a little bit more like a membrane.
Okay.
And it actually connects to the fascia in your back and chest. Oh, wow.
Creating this continuous layer.
Wait a minute.
Yeah.
This Scarpa's fascia,
Yes.
isn't this the part that contributes to, certain features down below? I'm
Yeah.
sensing a connection here.
Inferiorly, as we say in anatomy, Scarpa's fascia creates a sheath for some pretty delicate structures.
All right, moving right along.
Okay.
We got muscles to talk about, and I know everyone loves a good six-pack,
Sure.
but there's more to these abdominal muscles than meets the eye.
We're going way beyond aesthetics here.
Okay.
This is a complex interplay of muscles that allow for a whole range of movement,
Right.
provides stability,
Yeah.
and even protects your organs.
I was starting to feel a newfound respect for my abs.
You should.
So give us the rundown. What are the key players in this muscular orchestra?
Well, you've got the rectus abdominis, which is that famous six-pack muscle that's responsible for flexing the abdominal wall.
Okay, I've spent enough time trying to sculpt those.
Great.
What else is in the mix?
Then we have the external and internal obliques.
Think twisting and turning.
Yeah,
Those obliques are allowing you to do that.
right.
And finally, there's the transversus abdominis, and this runs horizontally, and it helps to compress the abdomen like a natural corset.
Wow, so it's like this perfectly engineered system of support and movement.
Yeah, it really is.
But wait, you mentioned something about a missing muscle.
I did.
I'm not sure. I'm ready to hear that some of my abs might be AWOL.
Yes.
Okay.
The mysterious pyramidalis muscle.
Okay.
It's this small triangular muscle at the bottom of the abdominal wall.
Interesting.
And the fascinating thing is, some people have it and some people don't.
Okay.
It's true.
Okay.
And its exact function is still being debated, but it just goes to show you how complex an individual human anatomy can be.
So some of us have a bonus muscle and some of us are rocking the streamlined version.
That's right.
Interesting. But we've got skin, we've got muscles, what's holding it all together?
That's where fascia comes in, the unsung hero of the body.
Okay.
And in the abdomen, we have something called the rectus sheath. Okay.
Think of it as a tough, fibrous casing that encloses the rectus abdominis muscle,
Right.
and it's formed by those flat tendons we call aponneuroses
Uh-huh.
from the other abdominal muscles.
So it's like nature's built-in corset, keeping everything in place.
It is.
Pretty neat. But I'm guessing surgeons have to know this area inside and out.
You're catching on.
Okay.
There's a spot called the arcuate line,
Okay.
and this is where the structure of the rectus sheath actually changes.
Okay.
Above the line, it has both an anterior and posterior layer, but below the line, only an anterior layer.
Okay. And why is that little detail so important?
Because below the arcuate line, the rectus abdominis muscle is lying right on top of another critical layer, the transversalis fascia.
Okay.
And if you're a surgeon, you don't want to mess with that.
All right, so what's the deal with this transversalis fascia? Sounds important.
It is.
Oh, okay.
Basically, it's a continuous layer of connective tissue that lines your entire abdominal and pelvic cavities.
Imagine an inner wetsuit, providing support and separating those powerful muscles from the organs beneath.
Okay, I'm getting a real sense of how layered and intricate this area is.
Yeah.
We've built up a solid understanding of those layers, from skin to muscles to fascia.
Yeah, we've done a lot of work.
But what keeps all this tissue alive and kicking?
That's where the blood supply comes in.
Okay?
We're talking about a complex network of arteries and veins weaving through the abdominal wall.
Right. Arteries carrying that oxygen-rich blood away from the heart, and veins bringing the deoxygenated blood back, Anatomy 101.
Exactly.
But I'm guessing things get a bit more complicated in the abdominal wall.
It's definitely complex,
Okay.
but there's also a brilliant redundancy built into the system.
Oh, interesting.
Many of these blood vessels have what we call anastomoses,
Okay.
which are basically connections that create backup routes for blood flow.
So it's like having alternate routes for those rush hour traffic jams.
Exactly.
Making sure the blood can always reach its destination.
Yes.
That's pretty cool.
Crucial for healing and keeping those tissues healthy.
Yeah.
But there's one connection that always surprises people.
Oh, real?
It involves a subclavian artery up near your collarbone
Uh-huh.
and the femoral artery down in your leg.
Wait, seriously, blood can travel from my collarbone all the way to my leg through my abdominal wall.
It is.
That's like some hidden anatomical superhighway. I never knew that.
It is, and it becomes especially vital if there are blockages in the aorta or the iliac arteries.
Right.
Those major arteries feeding your legs.
So these collateral pathways in the abdominal wall act like detours, allowing blood to bypass the blockages and still reach the legs?
Exactly.
That's incredible.
Okay.
Okay, my abdominal wall is officially way cooler than I thought.
I think we can all agree on that.
It's like this vascular highway keeping everything connected.
Yeah.
But we can't forget about the other systems that keep things running smoothly.
Right.
What about the lymphatic system? I know that's involved in immunity and fluid drainage, right?
Absolutely. The lymphatic system is like your body's filtration system,
Mm-hmm.
and it follows the path of the veins in the abdominal wall, just diligently draining lymph fluid from different areas.
So where does all that fluid end up?
Well, it depends.
Okay.
Above the belly button, lymph drains towards the armpit to those axillary lymph nodes.
Okay.
Below the belly button, it heads towards the groin to the inguinal lymph nodes.
Interesting. So what does this mean for surgeons? Do they have to factor in those drainage pathways?
Definitely remember those transverse incisions we talked about.
Right.
Well, they can actually disrupt this lymphatic drainage, which is why you might see some swelling in the area after surgery.
Right.
The body has to reestablish those pathways.
Okay, so another layer of complexity for surgeons to consider.
Yes.
We've covered skin muscles, fascia, blood vessels, lymphatics. What are we missing? Don't tell me there's more.
We can't forget about the nerves.
Right.
They're the control center for sensation and muscle function, and they're woven throughout the abdominal wall as well.
Right, because who wants numb spots after surgery?
Nobody wants numb spots.
So which nerves are we talking about here?
Primarily, we have the intercostal nerves coming from the ribs and the lumbar nerves originating from the lower back.
Okay.
And these nerves make their way into the abdominal wall between the muscle layers and then branch out to supply different areas. It's like a delicate wiring system.
And I bet surgeons have to be super careful not to snip those wires.
Absolutely. Each nerve is responsible for sensation in a specific area of skin, what we call a dermatome.
Right.
And if a nerve gets cut during surgery, you could end up with numbness or altered sensation in that area.
So it's not just about avoiding those major blood vessels. They have to map out the nerves as well
Exactly.
to minimize any sensory issues.
Yes.
It's like they're doing microsurgery on a massive scale.
Exactly. And it gets even trickier when you consider that some of these nerves also control those abdominal muscles.
Oh, right.
So if a nerve gets damaged, it can lead to muscle weakness, even paralysis,
Wow.
which then increases the risk of hernias down the line.
Okay, so nerve damage is a serious concern. Is there any particular area where it's a bigger risk than others?
You bet. The inguinal region where your thigh meets your abdomen is a hotspot for both surgeons and hernias. It's a complex area with several important nerves passing through.
Inguinal region, that's where those infamous inguinal hernias occur, right?
That's the one.
I've heard those can be pretty nasty.
They can be. And it's also where surgeons often have to operate to repair those hernias.
Right.
So understanding the nerve anatomy in this region is crucial to prevent complications.
All right, let's dive into this inguinal region. What makes it so surgically complex?
Well, for starters, there's this area called the inguinal triangle, also known as Hesselbach's triangle.
Okay.
It's a weak spot in the abdominal wall, and its boundaries are super important for surgeons to know.
A triangle sounds like a geometry lesson. Break it down for me. What forms the boundaries of this triangle?
Think of the base of the triangle as the inguinal ligament, which runs from your hip bone to your pubic bone. Then you have the medial border, which is formed by the edge of the rectus abdominis muscle, that six-pack muscle we talked about earlier.
Right.
And finally, the lateral border is the inferior epigastric artery.
Okay, I'm starting to picture this anatomical triangle. So why is it so significant in the surgical world?
Because hernias love to pop up within this triangle.
Oh, really?
The most common type, the inguinal hernia, occurs when a portion of the intestine pushes through the abdominal wall right in this spot.
So the triangle acts as a roadmap for surgeons, showing them where the hernia is most likely to occur.
Exactly. It helps them understand the anatomy of the hernia and plan the best way to fix it. But remember those nerves we talked about earlier?
Right.
They run right through this area too.
Oh, right. The iliohypogastric, ilioinguinal, genitofemoral, and lateral femoral cutaneous nerves. It's like a crowded intersection down there.
It is.
What happens if one of those nerves gets nicked during surgery?
Well, it depends on the specific nerve and how much damage is done. It could lead to anything from numbness and tingling to pain or even weakness in that area, for example. Damage to the ilioinguinal nerve can cause pain in the groin labia or scrotum.
Ouch. Not exactly the outcome anyone's hoping for.
No.
So surgeons have to be extra cautious when operating in this region to avoid hitting those nerves.
You got it. And they use a variety of techniques to pinpoint and protect the nerves during surgery. Sometimes they even use nerve monitoring to make sure they're not causing any damage.
Nerve monitoring sounds high-tech. How does that work?
They place electrodes near the nerves and use a device to listen to the nerve signals.
Interesting.
And if the surgeon gets too close, the device sounds an alarm, basically telling them to back off.
Wow, that's pretty amazing. Technology really is playing a big role in improving surgical outcomes.
It is.
So we've covered the inguinal triangle and those delicate nerves. Anything else we need to know about this inguinal region?
Well, we should touch on the spermatic cord in men and the round ligament in women. These structures run through the inguinal canal, which is basically a passageway through the abdominal wall.
Okay, remind me what those structures do again. I vaguely remember learning about them in anatomy class.
The spermatic cord contains the vas deferens, the tube that carries sperm from the testes, as well as blood vessels and nerves.
Right.
The round ligament helps to support the uterus.
Right. And are those structures at risk during an inguinal hernia repair?
They can be, the inguinal canal is a common spot for hernias, so surgeons have to be incredibly careful not to damage those structures when they're fixing the hernia.
It's like a surgical puzzle figuring out how to fix one thing without causing another problem.
It is.
So all in all, the inguinal region is a pretty sensitive area with a lot of important players crammed into a small space. No wonder it's considered a surgical challenge.
Absolutely. It requires a deep understanding of the anatomy and meticulous technique and a healthy dose of respect for the complexities of the human body.
Well, I'm feeling much more informed about what's going on down there. But we're not quite finished with the abdominal wall yet, are we?
You're right.
We still need to talk about those blood vessels in more detail.
We do. We touched on the blood supply earlier, but there's a whole lot more to explore.
Okay.
Remember that network of arteries and veins, both deep and superficial,
Right.
and those handy anastomoses that create backup routes for blood flow.
Okay, let's break it down. Can you walk us through the key arteries supplying the abdominal wall?
Absolutely. We'll start with the deep arteries. One of the most important is the inferior epigastric artery.
Okay.
It branches off the external iliac artery, a major artery in the pelvis, and travels upward along the inner surface of the abdominal wall.
And this inferior epigastric artery, what does it supply?
It provides blood to a large portion of the abdominal wall muscles, including that rectus abdominis, the six-pack muscle. It also has branches that pierce through the muscles to supply the skin and subcutaneous tissue.
Okay, so it's a pretty busy artery.
Yeah.
What other deep arteries should we know about?
There's the superior epigastric artery, which originates from the internal thoracic artery up in your chest. It travels downward on the backside of the rectus abdominis muscle, and get this, actually connects with the inferior epigastric artery around the belly button.
Wait, so these two arteries coming from opposite directions meet up in the middle?
It's a perfect example of how interconnected your body is.
Yeah.
And that connection is super important because it creates a continuous blood flow pathway between the chest and the pelvis.
So even if there's a blockage in one of those main arteries, blood can still flow through the abdominal wall to reach the other side? It's like a built-in safety net.
You've got it, and it doesn't stop there. We've also got the deep circumflex iliac artery, which branches off the external iliac artery and runs along the iliac crest, supplying the lower abdominal wall. And then there's the musculophrenic artery branching off the internal thoracic artery and supplying the upper abdominal wall.
Wow, it's like a whole network of interconnected arteries in there. It's mind-blowing how much is going on beneath the surface. So what about the veins? Do they follow a similar pattern?
They do, for the most part, the veins generally run alongside those arteries and have similar names. Okay.
So you have the inferior epigastric vein, the superior epigastric vein, and so on. Their job is to drain deoxygenated blood from the abdominal wall and send it back to the heart.
Okay, so it's a pretty symmetrical system,
Mm.
but I'm guessing there are some variations and nuances that surgeons need to be aware of.
You're absolutely right. The exact pathways of these blood vessels can vary from person to person,
I see.
and there can be extra smaller vessels that don't always show up on scans. So surgeons rely on their knowledge of anatomy and careful dissection during surgery to avoid causing any unnecessary bleeding.
It sounds like a delicate dance, trying to achieve the surgical goal while minimizing damage to all those vital structures.
Exactly, and that's why understanding the anatomy of the abdominal wall is so crucial for surgeons. It allows them to operate safely and effectively and minimize any risks.
Well, after this deep dive, I'm definitely seeing the abdominal wall in a whole new light.
Me too.
It's so much more than just about having a six-pack.
It's a complex and beautifully designed system of muscles, fascia, blood vessels, nerves, and lymphatics all working together to keep us moving, protected, and alive.
Couldn't have said it better myself. It really highlights the incredible design of the human body, even in a part that we often take for granted.
So what's next on our anatomical adventure?
Yeah.
We've covered a lot of ground, but I'm sure there's still more to explore.
You're right. We've been focused on the front of the abdominal wall, the anterior part,
Yeah.
but there's a whole posterior abdominal wall back there just waiting to be discovered.
Okay.
Think about it. We got major muscles, organs, blood vessels, and nerves back there.
Okay, you've got me hooked. The posterior abdominal wall. That sounds like a whole other deep dive waiting to happen.
It is, and trust me, it's just as fascinating as the anterior wall. We'll pick up our exploration there after a quick word from our sponsors. Stay with us.
All right, we're back and ready to venture into uncharted territory, the posterior abdominal wall.
Yes.
I'm picturing this wall behind all my organs,
Mm-hmm.
but honestly, beyond my spine, I'm drawing a blank.
It's definitely more than just bone back there. The posterior abdominal wall is like the scaffolding for your internal organs, providing essential support, and it's a superhighway for major blood vessels and nerves.
Okay, so it's structurally important and serves as a conduit for those vital pathways. But what muscles are we talking about here? What's holding up the back end, so to speak?
You've got some real powerhouse muscles back there. The psoas major is a big one running from your lumbar vertebrae down to your femur. It's a hip flexor, the muscle that helps you lift your leg.
Ah, so that's what's working when I'm powering up those stairs. Makes sense. What other muscles are back there?
Right next to the psoas major, you've got the iliacus muscle, which starts at the iliac fossa of your hip bone. Together, they form the iliopsoas muscle, a major player in hip flexion.
Okay, so these muscles are essential for movement. Are there any others we should know about?
Absolutely. The quadratus lumborum is another important one. It runs from your iliac crest up to your lower ribs. It helps with side bending and also stabilizes your spine.
So those posterior abdominal wall muscles are doing a lot of heavy lifting, both literally and figuratively. But you mentioned blood vessels and nerves running through this area as well. What exactly are we talking about?
We're talking major anatomical highways. The abdominal aorta, the largest artery in your body, runs right down the center of the posterior abdominal wall. It's the main supplier of oxygenated blood to all your abdominal organs.
Wow, the abdominal aorta. I
Uh-huh.
knew that was important, but I never pictured it back there. So
Yeah.
it must have branches that feed specific organs, right?
You bet. It branches out like a tree with the aorta as the trunk. You've got the celiac trunk, which supplies the stomach liver, and spleen, the superior mesenteric artery, which goes to the small intestine and part of the colon, and the renal arteries, which deliver blood to the kidneys.
Okay, so it's like this incredible branching network, making sure every organ gets what it needs. What about the veins? Are they also running through this posterior wall?
Yeah, they are the inferior vena cava. The largest vein in your body runs alongside the abdominal aorta, carrying deoxygenated blood back to the heart. And just like the arteries, it has branches collecting blood from corresponding veins, like the hepatic veins from the liver, or the renal veins from the kidneys, and so on.
So it's like a mirror image of the arterial system, but running in reverse deoxygenated blood flowing back towards the heart while oxygenated blood flows out to the organs. It's amazing how it all works together, but we can't forget about the nerves, what's going on with those in this region.
The posterior abdominal wall is a major nerve pathway as well. One of the most important is the lumbar plexus, a network of nerves that comes from your lumbar spinal cord.
The lumbar plexus, now that sounds familiar. Didn't we talk about some of its branches earlier when we were discussing the inguinal region and those potential nerve issues during surgery?
Exactly. The iliohypogastric, ilioinguinal, and genitofemoral nerves we discussed before all originate from the lumbar plexus.
So those nerves actually travel from the posterior abdominal wall around to the front, supplying those areas that we talked about. It all comes full circle.
It does, and the lumbar plexus gives rise to other key nerves too, like the femoral nerve, which supplies your thigh muscles, and the obturator nerve, which goes to your inner thigh muscles.
Okay, so the posterior abdominal wall is definitely more complex than I initially imagined. It's not just a wall. It's a dynamic hub of muscles, blood vessels, and nerves all working together to support our bodies.
Precisely. And just like with the anterior abdominal wall, surgeons have to be intimately familiar with this anatomy. Any procedures in the abdomen require a deep understanding of these structures to avoid complications.
Well, this deep dive has been an incredible journey. We've gone from skin deep to exploring the inner workings of both the anterior and posterior abdominal wall. And I have to say, I'm in awe of how it all works.
Me too. It's a testament to the intricate design of the human body.
What's the main takeaway you want our listeners to walk away with? What's the big picture here?
I hope they've gained a new appreciation for the complexity and elegance of the systems at work beneath the surface. It's a reminder that even the parts we rarely think about play a vital role in keeping us healthy and functioning.
I know I have. This has been a fantastic exploration of the abdominal wall, from the muscles we can see to the blood vessels and nerves we can't. And for those who want to delve even deeper, we've got some great resources linked in the show notes.
So until our next deep dive, keep exploring, keep asking questions, and keep marveling at the wonders of your own anatomy.
Because there's always more beneath the surface. Thanks for joining us on the deep dive.